is one of the many times people have the happiest memories of their lives. You do so much in your childhood, but these happy memories aren't with everyone. Children are not having these happy memories because of obsessive compulsive disorder taking away their life because they have to do these compulsions and do these obsessions. So one by one, they are just losing all the happy memories that any regular person would have. So what changes can the schools make to accommodate for these academic and social challenges that American school-age children face in their school years with OCD? I'm Maxine Newark. This is Eden Silva, Brittany Soares, and Yusuf Bibars. And Eden will now give you some information about OCD.
So there's a couple things that everybody should know about OCD. First of all, 2 to 3% of people in America have OCD. And OCD is characterized by obsessions and compulsions. And common obsessions can be obsession with numbers, so they'll think that some numbers are safe and others are evil, or fear of contamination, where they think some things are dirty and unclean, so they will excessively wash their hands and their surroundings to make sure this doesn't happen. And there's also obsession with perfectionism, where they believe they have to keep everything around them, like their desk, really neat and symmetric to make sure that nothing bad happens.
And here is Yusuf to talk about the weaker solutions that couldn't help.
Many people believe that pharmacological treatments like medications or other drugs should be prescribed by doctors and professionals in order for schools to utilize them to treat the students' OCD symptoms. On the other hand, many people believe that parents and families should be involved at home, and they should create a comfortable environment so that children at school can feel more safe about their compulsions and they won't experience these harmful symptoms.
And here is Brittany to talk about the best solution to help children with OCD.
School staff needs to be able to make school a safer and more comfortable place for students with OCD. This can be done by having school counselors or psychologists who can work to find treatments, having teachers help and accommodate to the OCD students' struggles, and also by having the school staff be educated on what OCD is so they will be able to identify it.
And here is Aiden to talk about the symptoms and how guidance counselors and school psychologists can help these children.
So like any other mental disorder, of course, there are symptoms. And besides the obvious compulsions and obsessions of OCD, kids with OCD will also have higher aggression and anxiety rates, which could lead to a worse social life and then higher depression and suicide rates. Also, kids with OCD will have worse event-based perspective memory, where the memory of events to come up. So possibly tests or assignments that they have in the future, they might forget about, and then they will have worse academic life as well. But some schools have psychologists, and other schools more often have guidance counselors who can diagnose OCD by using interviews and rating scales, such as the Yale-Brown Obsessive Compulsive Scale, or by evaluating kids and their daily procedures, such as in the classroom.
And here's Brittany to talk about how socially challenged the children with OCD are, and teachers can assign them group projects to help them.
Many students with OCD struggle with finding friends. This is presented by Melissa Laninger in Teaching Students with OCD, when she states that 50% of students with OCD struggle to be social in a school environment, and they tend to have social withdrawal from normal activities. Also, many OCD students are often bullied. This is presented by Margaret Jaffer and her colleagues when they state that many students with OCD are bullied because of their compulsive behaviors, and they try to hide it, which increases social isolation. But on the bright side, there are ways to fix these problems, and that is through teacher accommodation. Teachers can assign group projects to help students find safe friends, which is presented by Susan Black, who's the author of OCD and How to Help Kids with OCD. Group projects will help students be able to find safe friends who can help them, and it'll make other students more comfortable with OCD students and get to know them when they otherwise wouldn't.
Now, is it right for these children to go through the pain that they're going through with their obsessions and compulsions? Teachers are able to help that. Now, children that have OCD can have cognitive and metacognitive or behavioral difficulties, which can lead to them not finishing their work, which will lead to a higher academic failure. And as they progress, when they become adults, their symptoms will only keep worsening if they're not treated, and it's not okay for them to go through this pain all throughout their life. Teachers can help fix that with just incorporating a few things into their daily routine, like mindfulness. It can help every single child, not just the children with OCD. It can help them slow down their thinking and have a time for them to have a little bit of relaxation. Then, if they know what causes OCD, they can help make sure that none of their students have it, or if they do, they can help with their coping treatments and their therapies if they find that the child is suffering from their compulsions and obsessions. And here's Yusuf to talk about the weaker solutions.
Regarding pharmacological treatment, Eric Storps contends that it's a fast, easy, and efficient way to treat OCD, since all the student has to do is take a medication prescribed to them. He also found out in his research that students in their OCD symptoms actually get better over time after taking medications. However, this is simply not true, and it won't help their overall well-being. This is because P.H. Thompson, a researcher with a PhD in student understanding, says that symptoms like nausea, insomnia, and sleepiness are caused from medications. Also, Stork contends that medication is a much more expensive way than any other OCD therapy, like cognitive behavioral therapy. This means that you're paying more money for something that gives you more disastrous effects. Others that say that parents are the best way to conclude at treating OCD say that they can provide caring and lovable affection to their children, which will then provide a stress-free environment for these students. They can feel like they're all right with their symptoms and that their cognitive behavioral difficulties aren't anything that bad. However, most people overlook the fact that it makes the child feel like they're okay. This means that the child will likely not want to completely stop doing their compulsions, meaning that the treatment to find and to help these students is postponed to later.
And here's Brittany to discuss the limitations of our solution.
Even though this is a great solution to our problem, there are of course a few limitations to it. One is that teachers and other school personnel may look for extra compensation for the extra work and extra involvement that they have with these students who have OCD. Also, many students and parents may resist these treatments that the school is offering to them because they feel either that they have nothing wrong with them or that they can fix it themselves. Also, many of the other students may feel jealous of the extra attention that OCD students are having and could increase bullying. But in order to keep this from occurring, schools can have extra money set aside specifically for OCD matters and matters to do with mental disorders and illnesses. Also, we can make sure that parents and students educated on what the treatments are and how it can help these students and how it can make school easier for them. Finally, we can make sure that teachers are spending equal time with each student if they're struggling, no matter if they're an OCD student or not.
And now, here is Aiden to tell what everyone can agree on.
So everyone can agree that all kids deserve a fair and equal education. So school staff should work to identify, accommodate, and treat OCD in children.
Now, the positive changes that will happen if our solution is incorporated in schools is that there will be a less academic and social challenges. Kids will feel more welcome and they will be able to have an equal education, meaning that there will be a better classroom environment for them and everyone, and they will get the fair education that they deserve, that people have fought for. And here's Yusuf to tell you what you can do to help it.
So stop. Stop and look at the bigger picture of the situation. If children with OCD continue to be discriminated against, and if they receive a lack of education, then the future of the United States, and perhaps the future of the world, will face inequality in their educational systems.
Maxine, what is a way in which your team's resolution makes you think differently about your own individual research?
It doesn't make me think differently than my own individual research, because my individual research brought up the fact that teachers should help identify and accommodate for these students with OCD, and we as a group discussed that that was the best solution out of the other solutions that were brought up by Aiden and Yusuf, because it would more accommodate in school, and it just seemed with all the research that we had was the better solution for everything.
Aiden, having finished your project, what, if anything, do you consider to be a gap in your team's research that, if addressed, would make you feel more confident about your conclusion?
I feel like we could have more involvement about school counselors and school psychologists, because although we did have some information on it, it could have been more. Only I did research on that, and they were able to help out as well, but as we talked about it, we realized that there were some missing pieces.
Brittany, describe how the content of the team presentation was changed as a result of a group discussion.
At first, we had many different solutions. We mainly had a lot of solutions that had to do with medical treatment. A lot of us included that in our research, and we had a lot of research on medical treatment. But we then changed that to do with teachers accommodating and identifying, because that was a better way to help in school, and was overall, we had more research to do with that.
Yusuf, give one specific way that your thinking changed as a result of learning about Aiden's findings.
After having many conversations with Aiden about his perspective, the scientific lens, I found out that symptoms of OCD not only cause detrimental effects to the classroom, but they cause other major parts of somebody's health, like depression, and it can possibly make them more socially isolated as a result of this.